Cure rates relating to the surgical therapy of early-stage breast cancer is fundamental to the understanding of surgical treatment choices. Therefore, I wish to share my thoughts on this subject. Of course, better cure rates translate to living longer in survivorship, and it is important to review the evidence before making our treatment decisions. We are already aware that there are two broad categories for the surgical treatment of breast cancer. If she is suitable, a patient may choose to undergo breast conservation treatment, or she may select mastectomy. There is ample evidence demonstrating that breast conservation treatment is associated with improved survival outcomes. In this video, I will share excerpts from two studies. The first is by this team of doctors from China, who published a report in 2023 where they found that the survival period of patients who underwent breast-conserving surgery was significantly longer than that of patients who had a mastectomy procedure. There are also studies from other healthcare centers which support this finding, although in a different fashion. This is another study, a meta-analysis published in 2025, which supports the findings of the earlier study. A meta-analysis is a statistical evaluation of the combined results from several studies conducted on the same subject. It usually involves the comparison of two different treatment approaches for the same disease condition. As we see in these excerpts from their report, the team of researchers found significant benefits of breast-conserving surgery, abbreviated as BCS, on overall survival when compared with mastectomy, written in short form as MX. What the results mean is that a greater proportion of women who underwent breast conservation treatment were alive 10 years after surgery. Overall survival is a surrogate for cure, and the findings can be interpreted that the cure rate with breast conservation treatment is higher than that with mastectomy. In summary, if a patient with breast cancer is a suitable candidate for breast conservation treatment, and she is given the option of breast conservation or mastectomy, the research evidence shows that choosing breast conservation treatment will likely allow her to live longer. In this video, I have shared just two studies which have shown better survival and longer survival periods with breast conservation treatment. The references for them are listed in the video, and I encourage you to fact-check and verify them. The content in this video is solely for educational purposes and not intended as a substitute for consulting your doctor. If, however, you wish to have more information to discuss with your surgeon, please feel free to watch other videos on this channel. I look forward to interacting with you again. Until then, take care.